For decades, the quality unit has been designed to protect the patient, protect the product, protect the organization, and for a long time that was enough. Compliance was the center of gravity. Success was measured by the absence of findings. But today's world is different. Global supply chains are extended. Regulatory expectations are evolving. Business timelines are compressed. In this environment, compliance alone is not sufficient. What organizations now require is a high potential quality unit, one that safeguards compliance, but also enables leadership, one that protects integrity, but also drives performance. Today, we will explore the high potential quality unit framework, a practical integrated model that transforms quality from a compliance engine into a leadership catalyst. The high potential quality unit framework is not a compliance tool. It is not a maturity ladder. It is a dynamic framework that evolves with the organization. At its core, it integrates 5 capability areas. 1. Quality strategy. 2. Purpose-driven compliance. 3. Agility. 4. Collaboration. And 5. People development. These are not independent pillars. They reinforce one another. Weaknesses in one area limit the others. Strength across all 5 transforms the quality unit into a strategic force. Let us explore each element and how they connect. Quality strategy is a bridge between organizational vision and daily operational decisions. Every organization speaks about quality at the policy level. Mission statements emphasize patient safety, product integrity, and regulatory compliance. But most failures do not occur at the policy level. They occur in the space between policy and practice. That gap emerges when vision is not translated into clear, actionable quality objectives. When people understand the vision but do not know how that vision should guide their decisions. This is where quality strategy becomes essential. A strong quality strategy provides direction and clarity. It helps the organizations move from intent to execution. And at its core, a well-designed quality strategy answers 3 fundamental questions. What matters most? Where are the risks that could affect product quality, patient safety, or regulatory confidence? Where are the risks? What processes, systems, or decisions have the greatest potential to create a variability or failure? And finally, how do we control by design? Not by detecting problems later, but by building controls directly into the system from the beginning. A mature quality strategy therefore has 3 important characteristics. It is risk-based, focusing attention and resources where the impact is greatest. It is measurable, supported by clear indicators that allow organizations to monitor performance and detect signals early. And it is lifecycle aligned, recognizing that quality must be designed and protected throughout the entire product journey. Because quality is not created at the point of inspection. It must be built into the system from the very beginning. Quality must be designed into formulation development, process characterization, technology transfer, commercial manufacturing, and continuous improvement. When quality strategy is embedded into these stages, the organization moves from reactive control to predictable performance. And when quality becomes predictable, something powerful happens. The business moves faster, teams make decisions with greater confidence, resources are focused where they truly matter. Inspection, of course, still has a role, but inspections primarily finds problem. Strategy, on the other hand, prevents them. And sustaining that difference is ultimately the responsibility of leadership. Because strong quality strategy is not just a technical exercise, it is leadership discipline. Leadership sustains quality strategy. Compliance is often misunderstood. Many people believe compliance slows organizations down. But in reality, compliance is not the enemy of speed. Uncertainty is. When teams are unsure about risks, unsure about expectations, and unsure about consequences, decisions slow down. Traditional compliance often asks a very narrow question: is it allowed? And the answer usually becomes a simple yes or no. But modern organizations operate in complex environments where decisions are rarely that simple. Purpose-driven compliances ask a deeper question: what is the risk? What could go wrong? What could impact patients? What could affect product quality, safety, or trust? And most importantly, how should we make the right decision in that context? When compliance is viewed through this lens, the role of quality unit begins to evolve. The quality unit is no longer just reviewing documents after decisions have already been made. Instead, it becomes part of the decision-making process itself. The role shifts from document reviewer to decision shaper, from enforcement to influence. Purpose-driven compliance is built on three key elements. It is risk-based, focusing attention where the quality truly matters. Purpose-driven compliance is risk-based, context-aware, decision-oriented, and when done correctly, it builds trust. Trust with regulators, trust with leadership, trust across the organization. The quality unit becomes not just a function, but the ethical center of the enterprise. It is context-aware, understanding the scientific, operational, and regulatory environment in which decisions are made. And it is decision-oriented, helping the organization make better, faster, and more responsible choices. When compliance operates this way, something powerful happens. It builds trust with regulators because decisions demonstrate sound judgment, trust with leadership because compliance enables clarity rather than creating barriers, and trust across the organization because teams see the quality unit as a partner in responsible decision making. At that point, the quality unit becomes something more than a department. It becomes the ethical center of the enterprise, a place where science, judgment, and responsibility come together to guide decisions that ultimately protect patients and sustain trust in the organization. Systems do not fail fast. Culture does. Agile quality does not mean speed. It means adaptability with integrity. Traditional systems were rule-heavy, reactive, defensive. Agile systems are learning-oriented, preventive, responsive. But agility cannot exist without cultural alignment. It stands on four pillars: openness, where issues surface early; transparency, reflects data or defensiveness; integrity, taking right decisions under pressure; accountability, have ownership without blame. Psychological safety is not a soft concept. It is a risk management strategy. In agile cultures, deviations become data, audits become insight, improvement becomes habit. Technology supports agility, but culture enables it. Agile quality systems do not start with dashboards. They start with trust. Quality does not stop at your gates. Modern quality leaders are not gatekeepers. They are connectors. Consider the complexity of modern systems. Pharmaceutical operations are highly intricate, and quality impacts every stage and every participant across the value chain. Regulators are now looking beyond compliance documentation. They are assessing the actual quality culture within the organizations. With the rise of outsourcing, contract manufacturing organizations, and global supply chains, the risks and opportunities for quality excellence are amplified. The key mindset shift here is moving from quality owns compliance to quality enables shared accountability. As a result, quality must partner with manufacturing, R&D, engineering, supply chain, regulatory affairs, and senior leadership. Let's look at how quality interacts with different departments. In operations and manufacturing, the collaboration is key for investigations, managing deviations, process control, and conducting Gemba walks. In R&D and process development, the team works with quality on quality by design, critical quality attributes, and technology transfers. And engineering and IT rely on quality for validation, automation, and ensuring data integrity. The supply chain and procurement teams partner with quality to manage supplier risk and ensure material reliability. The regulatory affairs and senior leadership also play vital roles with quality supporting CMC alignment, inspection readiness, and acting as a business enabler. And now let us consider the key external stakeholders. Supplier and vendors provide raw materials, components, and critical services. Their quality directly impacts the product quality. CMOs or contract manufacturing organizations or contract research organizations are responsible for outsourced manufacturing and clinical studies. Seamless integration of quality processes with these partners is vital. Regulators play a crucial role through inspections, review, and post-approval commitments. Transparency and readiness are essential for successful regulatory engagement. Pharmacovigilance networks monitor real-world safety data and adverse events throughout the product lifecycle, helping us maintain and improve quality post-market. When collaboration matures, finger-pointing disappears. Co-ownership emerges. Quality becomes influence without authority. The question shifts from who is responsible to how do we solve this together? No framework succeeds without capable people. Systems provide structure, processes create consistency, but ultimately people create performance. Even the most carefully designed quality systems depend on the judgment, courage, and curiosity of the individuals who operate it. This is where high potential quality teams begin to distinguish themselves. They do not simply follow procedures. They demonstrate strong decision-making capability, understanding when to apply rules and when to apply judgment. They remain confident in ambiguity, recognizing that complex situations rarely come with perfect information. They have the courage to challenge, asking difficult questions when something does not appear right. And perhaps most importantly, they maintain a willingness to learn, constantly improving their understanding of science, systems, and regulatory expectations. But these behaviors do not emerge automatically. They are shaped by leadership. Quality leaders play a critical role in building the conditions where high potential teams can thrive. Effective leaders begin by asking better questions. Not only is this compliant, but also what is the underlying risk? What assumptions are we making? What can we learn from this situation? Leaders who encourage external learning, exposing teams to new ideas, industry practices, and evolving regulatory expectations, because quality organizations that stop learning quickly becomes reactive rather than resilient. Strong leaders also recognizes the value of incremental improvement. Not every improvement needs to be dramatic. Small, consistent progress strengthens systems and builds confidence within the teams. And during moments of uncertainty, which every organization eventually faces, quality leaders must demonstrate something equally important: composure. Because teams take emotional signals from leadership. When leaders remain calm, thoughtful, and balanced, They create an environment where people can focus on solving problems rather than reacting to pressure. Over time, these behaviors shape something much deeper than performance. They shape culture. And culture rarely changes through policies alone. Culture changes when leaders change first. When leaders model curiosity, integrity, and thoughtful decision making, those behaviors gradually become embedded in the organization. Ultimately, the high potential quality unit is not defined by procedures or frameworks. It is built on leadership intent, the intent to develop people, the intent to strengthen judgment, and the intent to create a quality culture capable of navigating complexity with confidence. The high potential quality unit does not abandon compliance. It elevates it. It does not chase deviations. It designs robustness. It does not enforce culture. It shapes it. It does not guard gates. It connects ecosystems. And it does not operate in isolation. It leads with intent. This is not about doing more quality. It is about doing quality with clarity, courage, and strategic influence. When quality evolves, the organization evolves. When quality leads, confidence replaces uncertainty. And when leadership and quality align, excellence becomes sustainable. This is the high potential quality unit. And this is how we build the next generation of life science leaders.